So one person who is involved in the medical field wrote in a little bit about our discussion about ethics. Yeah, and so I thought I would share here. Okay, so he says it's very, being in medicine is full of difficult questions about ethics. Okay, so here looking at it a little bit from the pharmaceutical viewpoint, a doctor writes a prescription for an antibiotic. The patient brings it to the pharmacist, who realizes that the patient only has a common cold. Okay. By dispensing the antibiotic to the patient, the pharmacist brings harm to the patient. Okay, because the antibiotic does nothing to help the common cold, but destroys the person's GI tract and raises liver enzyme function. Okay, so does the pharmacist give the antibiotic or not? Yeah. I don't know. Are they compelled by law to fulfill a doctor's prescription? Yeah. So the pharmacist calls the doctor, and discusses it, and how to treat the patient. It involves a bit of skill because, you don't want to accuse the doctor of not knowing what he's doing. Yeah. And some pharmacists may want to fulfill the prescription just because they make money on it anyway, but you have to have a sense of ethical concern. Okay, then he gives another example. A physician writes a prescription for narcotics, say for severe pain. The patient needs higher and higher doses of the meds, and can become addicted. So does the pharmacist continue dispensing? Yeah, even though the doctor keeps writing the prescriptions because the patient keeps saying that they're in pain, but the pharmacist knows that it's an addictive thing. The patient's had it a while before. Yeah, so it's usual that you would need more over time, but at what point do you discern that it's becoming addictive? Yeah, what the... Right. Okay, so if it's a terminal illness, the addiction factor doesn't matter so much. But if it's chronic pain, continuing to take an opiate is very, very harmful to the person. Yeah. Yeah, and so I was thinking also about this situation with so many young people, teenagers and young adults being given Adderall for ADHD, and yet it is addictive. And because I read one story about somebody who went into his college healthcare center and said he can't concentrate, and got a prescription and started, first he was taking it by buying pills from people in his dorm, and he really liked it, and it helped with his concentration, and so then he went and said, I have ADHD, and they gave him a prescription of his own, and then he kept on getting more and more prescriptions, and eventually, I think he actually died somehow from it. I'm not sure how he died, but the way it was somehow related to having an Adderall addiction. Yeah. So, the family, of course, was very upset, and they wanted to talk to the doctor. Why are you prescribing this? Yeah. And so do doctors really stop and give people proper examinations to determine if they really if they're ADD or ADHD, or does the doctor just, somebody says, somebody at college says, I can't concentrate, and then it's so easy, write a prescription, and there you go. Yeah. Or the same, actually, for little children getting the meds. apparently, somebody said that it's like an epidemic of ADD and ADHD in the U.S. right now, because there's so many more people, that are said to have this and that are getting drugs and for it. And so some people are saying, well, it's an epidemic, and other people are saying, no, it's always been this bad. It's only now people know about it, and so they come in. And then other people are saying, we're giving these drugs to little children, without knowing the effects. And then some people are saying, well, what are our children's lifestyles like to make them so hyperactive to start with, And this last factor, I don't think people are examining well enough. When you have a kid that's hyperactive, it can be so tearing and so draining that it's like, just give me a pill and, get this kid to quiet down because the parents are frazzled. But then without really looking at all the other factors and what else is involved. Yeah. So, ethical concerns really come into all of this. And I think especially with pharmacies now advertising to patients as if patients were consumers, so that people who are sick go into the doctor's office saying, I want a prescription for X and X, because they saw it advertised and it's supposed to be, so wonderful for you. So then, it's difficult for the doctor. Yeah. But then what about the pharmaceutical companies? Is that really ethical to advertise to start with? When you're trying to increase your business? Now, certainly, you can say if patients have information about drugs, that could be useful to them. But then when the information is presented in a way that's encouraging the patient to self-diagnose and self-prescribe, and they just need the doctor to sign it, then, isn't there some kind of ethical responsibility on the part of the pharmaceutical company? Yeah. So there's all sorts of things, in all of our, businesses that need to be taken into consideration. The same is true for herbal supplements, yeah? That many people take them, and yet there haven't been tests done on them to see if they really work, and yet people spend millions of dollars on herbal supplements, and so they're okay that people know there hasn't been research done, so it's there, But then can you overtake a supplement? Or can you take too many of a certain kind of vitamin or whatever? Yeah, yeah, so you can. So, so then there has to be caution there too, and especially, because you look in the bottles, say take so much every day, but then they don't tell you if you're taking this and this and this and this, then maybe you don't take so much of this one every day because you're getting that same vitamin or mineral or whatever from another source as well. So, it's quite difficult, but something to be very aware of. Yeah.
Some years ago, I had a private practice as a nurse practitioner in mental health, and drug reps would come to our group and want to offer us lunch and all these. They'd bring all these things, pins and just stuff, like here. And then what they talked about was, this is the best thing for your patient. It's much better than any of the other things. Any of the other drugs that are in the same class. This is the new, the new version. And so, at first you can get kind of hooked into that. It's just consumer mentality, actually. And, many of the new drugs, the downfall to all of them really is there hasn't been much not a whole lot of testing, and you really don't know much about them, you know. And they would give you free. So they would give you samples of these new drugs. And at least in my practice, what would happen if I would use them, then if it did work and then the person was going to go ahead and take, then the insurance company wouldn't cover it because it wasn't a generic drug. So it was just such a, you know, it was not helpful at all. So our group, we just quit really doing, you know, having the drug reps come, and they didn't like that at all. But, you know, and then the other piece to that is that oftentimes people would come in and they would read or hear on the TV, this is what I need. And, you know, oftentimes, you know, I'd say, well, you know, let's, you know, evaluate and see what. And then, you know, oftentimes that wasn't what I thought should be. And I would say, no, I'm not going to give. And they would get so mad and they would leave. And that was the end of it, you know. So, and they'd go to someone that would, I guess, maybe give. So it's like, it took a lot of focused effort, really, to keep the patient's best interest in mind, no matter what was coming at you from either side. So it wasn't so easy, actually.